Anxiety-induced heart palpitations feel like a fast heartbeat, triggered by your body's fight or flight response to perceived danger. While usually not harmful, these palpitations can intensify anxiety and may cause complications. In this episode of A Healthy Dose, we will explore ways to manage and stop anxiety-related heart palpitations, both through medical and non-medical approaches. Understanding heart palpitations is important. A typical heart rate falls between 60 to 100 beats per minute. If it goes beyond 100 beats per minute, you may sense a strong or irregular heartbeat. Palpitations caused by anxiety are usually brief and occasional, but during panic attacks, they can be more prolonged or intense. So, how can you slow and stop anxiety-induced heart palpitations? If anxiety is causing your heart palpitations, the key is to tackle the root issue, anxiety itself. To alleviate palpitations linked to anxiety, try the following techniques to manage your symptoms. Technique number 1. Focus on your breathing. Practice mindfulness, meditation, and deep breathing to ease anxiety and stabilize your heart rate. Anxiety can sneak up on you and impact you physically. If you experience palpitations, it might be a sign that your anxiety is affecting your body. Take a few minutes to slow your breathing, meditate, or find a quiet space to calm your mind and body. Technique number 2. Exercise. Staying active isn't only beneficial for your body, it also promotes heart health and helps prevent heart palpitations. Additionally, exercise triggers the release of endorphins, which are natural chemicals that aid in managing stress by providing a quick mood boost. Technique number 3. Use your body's cheat codes. If you are feeling stressed or anxious, there are some simple moves you can try to help your body cope. When anxiety kicks in, your body goes into fight or flight mode, and you might feel your heart racing. The vagus nerve plays a role in regulating your heart, and doing certain things like pretending to have a bowel movement or trying the Valsalva maneuver can sometimes quickly bring your heart rate under control if it's too high or irregular. Technique number 4. Eat or drink. Eating or drinking might seem like simple, everyday activities. However, when you take a moment to enjoy a snack or a drink, you are allowing your body to carry out a task automatically. The process of swallowing naturally slows down your breathing, and this focused action can actually help to calm any palpitations you may be experiencing. Technique number 5. Ask for help. If your heart starts beating really fast and makes you feel dizzy or lightheaded, don't hesitate to seek assistance. While anxiety could be a reason for this, there are also physical reasons it might happen. If you experience chest pain, dizziness, or fainting, it's crucial to get prompt medical help. Technique number 6. Ask for help again. If you have checked for any physical issues causing your heart palpitations and they still won't go away, even after trying things like meditation, it might be a good idea to seek extra help. Talking to a therapist or counselor who is licensed can be really useful. They can help you understand where your anxiety is coming from and teach you how to handle it well so you don't feel it physically in your heart. Technique number 7. Consider medications. If your anxiety continues to make you physically uncomfortable, despite trying behavioral strategies, consider discussing anxiety medication with a healthcare provider. If you regularly have heart palpitations along with anxiety, it's crucial to seek ongoing treatment and support from a healthcare provider, even if the suggested activities and techniques bring temporary relief. So, how to manage stress and anxiety without medication? Approximately 7 million adults experience anxiety disorders at any given time. Various treatments exist, and effectively managing anxiety is key to improving your quality of life. Regularly practicing non-drug techniques can be beneficial in controlling anxiety and its related symptoms for some individuals. Some ways to cope with anxiety without without medication include: number 1, practice mindfulness and meditation. Number 2, try relaxing activities like exercise. Number 3, use deep breathing exercises. Number 4, seek cognitive or behavioral therapy with a licensed counselor. Number 5, join support groups with peers facing similar challenges. Moreover, what medications are prescribed for anxiety? If your usual methods for handling anxiety don't work and you are still dealing with symptoms like heart palpitations, talk to a healthcare provider. They can give you medication to help with anxiety. There are different types of anxiety medications, each with pros and cons. It might take some time to figure out the right one for you, as everyone reacts differently to medications. Discuss the following anxiety medications with your healthcare provider. Medicine number 1, serotonin reuptake inhibitors. These are a type of antidepressant. Medicine number 2, selective serotonin or epinephrine reuptake inhibitors. These are another class of antidepressants. Medicine number 3, tricyclic antidepressants. These are also a type of antidepressant. Medicine number 4, benzodiazepines. These medications are known for their sedative effect, commonly prescribed for anxiety. Medicine number 5, pregabalin, a sedative medication sometimes used for anxiety and sleep issues. Medicine number 6, beta blockers. These are medications that are typically used to control high heart rate and or high blood pressure. Medicine number 7, buspirone, a medication occasionally used for generalized anxiety or depression. Medicine number 8, moclobemide, a secondary therapy often described for seasonal affective disorder. It takes a while for many of these medications to show their full effect. They must be started and stopped gradually. Only use these medications with the guidance of a healthcare provider. Anxiety, your thoughts, and your body. Your body and mind are closely linked, and they can affect each other. It's crucial to know that feeling anxious can impact both your emotions and physical well-being. For instance, your heart rate might change, and you could experience palpitations due to anxiety. Pay attention to any stressful situations that might be linked to these physical symptoms, and find ways to deal with them in your daily life. Practices like meditation, deep breathing, and other holistic activities can be beneficial. If needed, consult a healthcare provider who can recommend a therapist or prescribe medications for extra support. In summary, people with anxiety may feel their heart beating fast or irregularly, which is known as heart palpitations. Usually, you don't need direct medical treatment for these palpitations, but you can manage them by reducing stress and anxiety. If methods like relaxation techniques don't help, it's a good idea to talk to a healthcare provider. And if you ever notice palpitations along with issues like difficulty breathing, dizziness, or chest pain, seek medical help right away. Thank you for watching. Please like, comment, and subscribe. Watch more videos by clicking on the video here.